was the weekend before Christmas. I was out enjoying some good times with some friends. So yeah, we're out at the club together. And a few days later, we all started to develop our symptoms.
When Sydney-based Mitch Jones started getting sniffly and returned a positive rapid antigen test, he was almost certain he had COVID.
For me, I started getting a little bit of congestion in the nose and quite like a short, sharp cough that I don't usually have. So I got up early the next morning to go to one of the St Vincent's Hospital clinics in Darlinghurst.
2 days after taking the PCR test, Mitch got a surprise.
About 8 o'clock on Christmas night, I got my negative result. And so I didn't quite believe the results for the PCR, so I followed up with another rapid, which showed again that I was positive. I was incredibly confused.
The next day, Mitch got a text saying there'd been a mistake and he actually did have COVID. He was one of nearly 900 patients at SydPath, St Vincent's Hospital's testing clinic, who received negative results in error.
Tonight, a COVID testing bungle. Hundreds of people told they don't have the virus despite testing positive.
Text messages were sent to almost 1,000 people confirming a negative COVID-19 result when they could be positive.
An emergency response team is now investigating the cause of this mistake, which is believed to be due to human error.
It was shocking to realise that it was more than just me and a few of my friends, that it was a whole lot of other people. It makes you question the whole entire process.
7:30 has obtained an email written by a St Vincent's staff member which outlines major concerns about the pathology lab. The email, which was sent to the Health Services Union, says, "Some equipment in the labs is unworkable and not being fixed. There's a distinct lack of care for maintaining equipment and not enough resources to process tests accurately. Staff are working 14 to 16-hour shifts, sometimes even when they're sick. There are no contingency plans for staff shortages."
Unfortunately, this is not surprising and typical at the moment. We're seeing, particularly in health workers working in the pathology areas have been suffering chronic fatigue due to the fact they've been working incessantly over the past 18 months to nearly 2 years. That is taking its toll. The lack of resources, the lack of support and the abundance of work to perform under pressure is really at the point of putting people in harm's way.
A St Vincent's spokesperson said in a statement that SydPath staff have been working additional hours, have been well supported and have never been asked to work while unwell. The error on the 25th December occurred because SydPath labs were pooling tests. To prevent any chance of this happening again, the pooling of swabs has ceased, all results are cross-checked, testing sites have closed and others have had their hours cut to ensure reduced test turnaround times and to address staff fatigue, and rapid antigen tests are being issued where appropriate. With thousands of people turning out to PCR testing every single day, Greg Granger from rival pathology group HistoPath told 7:30 Australia's entire testing system is at breaking point.
With all of this pressure, an enormous demand on a system, with capacity stretched to its limit, it was inevitable that there was going to be something like this occur. And as I said, it could have happened to us or any other laboratory, and these things are likely to keep occurring in the future.
As more people catch the virus, the old way of processing tests, where multiple swabs were tested in a single batch and retested individually if COVID was detected, has faltered.
Omicron has turned our laboratory's capacity on its head. Under the normal circumstances of Delta and other outbreaks, the ratio of positives to negatives within the community was very low. Now, with Omicron, there are greater complexities because it has gotten away from us so quickly that we haven't been able to make these adaptations and these changes quick enough to keep ahead of that curve.
PCR tests are currently free for patients, funded by the federal government. As a result, private pathology labs have recorded large profits. Greg Ranger rejects criticism that businesses like his have put those profits ahead of community needs.
We've invested millions, even in the last month, into shifting our platforms, ensuring that we've got the hardware and the capital required for this next phase of the pandemic.
In the midst of a growing outbreak, a number of testing clinics have temporarily shut down. Last week, National Cabinet agreed to remove the requirement for a PCR test to confirm a positive rapid antigen result. And all states, apart from WA, have ditched lab tests as a condition of entry. Staff at this COVID clinic are still dealing with record numbers of patients.
We have done like 1,000 or 1,500 tests in 4 to 5 hours. Like, that's a huge number. And then it's definitely increasing. The number of tests, I don't know, maybe because of the positive cases are also increasing and the people are paranoid and they want to get tested every time, every now and then.
We are overworked. Like, we're beaten, and there's still a lot of enthusiasm, there's a lot of energy to get the job done. But we're working under extraordinary circumstances that are really, we've never seen it before.
People like Mitch Jones are sceptical that our COVID response will ever get ahead of the curve.
It's pretty crazy to think that we've spent 2 years of our lives, like I spent 2 years of my prime locked up in my apartment, and like I'm never going to get that back. Us as people, we've kind of prepared for what comes next, but it feels like everything else hasn't kind of prepared with us. So it's quite frustrating.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.